I'm so excited to be here. I just want to tell you, we're going to talk a little bit about breast cancer and a little bit about the Breast Cancer Resource Center as well. So I have a presentation. I hope you all can see that fine. And here we go. So, let me tell you a little bit about myself. Sorry. In order to be a patient navigator at the Breast Cancer Resource Center, you have to have had breast cancer. So I was diagnosed with breast cancer in April of 2014. And oh, goodness graciousness, I went through it all. I had chemotherapy, and then I had surgery, and then I had radiation, and I'm still on an estrogen blocking drug. But all is good 6 years later. So I'm really happy to be able to now help other clients go through the breast cancer diagnosis. So at BCRC, which that's the Breast Cancer Resource Center, we work every day to empower those affected by breast cancer with personalized support and compassion. Our vision is a future where no one faces breast cancer alone. In honor of 2020 being our 25th year, I want to begin this presentation with a brief video that will take us back to the very beginning of BCRC.
The Breast Cancer Resource Center was founded in March of 1995 by two breast cancer survivors, Sherry Smith and Ann Lawler. Despite humble beginnings in a small office in donated space, BCRC provided invaluable resources to its community, including a lending library, network of peer support volunteers, and telephone helpline. Passionate volunteers offered compassion and hope to the women who reached out for support. The organization continued to grow, BCRC hired its first paid executive director. Recognized as a trusted community resource for women facing breast cancer, BCRC was approached about starting a support group for women with metastatic disease. So in 2002, BCRC founded the Ivy League. In 2006, Entre Mujeres, the first Spanish-speaking support group, was created. Later that year, 3 young women with young children were diagnosed with breast cancer and asked BCRC to start a special program for women 45 and younger, and the Pink Ribbon Cowgirls was created. The first patient navigator was born in 2008 after all BCRC client services staff were trained at the Harold P. Freeman Patient Navigation Institute in New York City. The Lotus Link Online Support Forum was launched in 2013 and reduced the barriers to community and connection among BCRC's clients. And in 2015, BCRC began After Breast Cancer, a multi-week course taught by subject matter experts designed to ease the transition women experience from active treatment into survivorship. Although 2020 has been a challenging year for many, BCRC quickly adapted and converted all of their support groups to web-based and was also able to launch a new support group, Pink Table Talk, specifically for African American women. Today, Breast Cancer Resource Center employs a staff of 6 professional patient navigators who have all had breast cancer. The navigators guide, assist, and provide compassionate care to hundreds of women and their families every year. BCRC patient navigators continue to be beacons of light to their clients, reflecting all the possibilities of a life well lived. They remain steadfastly committed to the mission as they have for 25 years. They still offer help, hope, here.
So that video provides you with a very quick timeline of how BCRC has grown over the past 25 years. Since our inception in 1995, we have grown into the largest nonprofit in Central Texas that offers patient navigation and support to and support services to all women. We provide a safe space for our clients to ask questions, explore options, and connect with other women with similar experiences. We serve women living in Travis, Caldwell, Bastrop, Williamson, and Hays counties, But now due to COVID, because we do so much remotely, we're able to assist women outside of those counties virtually. So before we get into what we do at BCRC, I think it's important to share some introductory breast cancer information. Breast cancer is the second most common cancer among women in Texas and in the US. Oops, sorry. I was scrolling instead of, I got to do this. Okay, sorry. It's estimated that 18,000 women. Did I do that again? Okay, I'm not very good at doing a slideshow on Zoom. Bear with me. Okay, let's see if I can do this right here. I got ahead of myself, sorry. Here we go. All right, that's the slide I want to be on. It's the most common breast cancer among women it was second most common breast cancer or cancer among women in Texas and the US. It's estimated that 18,000 women will be diagnosed with breast cancer this year in Texas, and over 3,000 will die from breast cancer. 11% of breast cancer cases in the US are diagnosed in women under the age of 45. Really scary. Every 13 minutes, a woman dies from breast cancer. In general, 1 in 8 women in the US will be diagnosed with breast cancer. Because the majority of breast cancer cases are caused by environmental or lifestyle factors, there are steps that everyone can take to reduce their risk. The Centers for Disease Control and Prevention recommends keeping a healthy weight, exercising regularly, and limiting alcoholic drinks. Other prevention tips the CDC recommends include having a conversation with your doctor if you're currently taking hormone replacement therapy or oral contraceptives. Breastfeed your children if possible, and consulting your doctor to learn about more ways to reduce your risk if you have a family history of cancer. So now I will highlight some risk factors that you cannot change and influence your risk of being diagnosed with breast cancer. The first of these is getting older. The risk of breast cancer increases with age, and most breast cancers are diagnosed after the age of 50. Some genetic mutations can increase your risk of developing breast cancer. Girls who started their menstrual periods before the age 12, or women who start menopause after age 55 are exposed to hormones longer and therefore have a higher risk of getting breast cancer. Having dense breasts, I had dense breasts, means having more connective tissue than fatty tissue, and we are more likely to get breast cancer. Both personal and family history of breast cancer increase the chance of getting breast cancer. And finally, women who have been treated with radiation therapy to the chest or breasts for other health reasons before the age of 30 have a higher risk of getting breast cancer later in life. So while screening cannot prevent breast cancer, it does help find breast cancer earlier, making it easier to treat. As always, you should consult your doctor and talk about which breast cancer screening tests are best and right for you and when you should have them. One recommendation doctors give all of their patients, no matter what their age, is to do regular breast self-exams. Become familiar with how your breasts are and how they look and feel. Being familiar with your breasts can help you notice any changes, such as lumps, pain, or size changes that may be concerning. Another recommendation is to have a clinical breast exam during your yearly wellness check with your OBGYN. The current recommendations for women at average breast cancer risk are shown in this graphic. Women between 40 and 44 have the option to start screening with a mammogram every year. Women 45 to 54 should get mammograms every year. Women 55 and older can transition to a mammogram every other year or can also continue with annual mammograms. If you're under the age of 40 and higher than average risk of having breast cancer, you should talk to your doctor and identify if you should be getting mammograms earlier. The FDA has also approved 3D mammography as means of breast cancer screening. It differs from traditional mammography that gives you one picture. A 3D mammogram provides you with a three-dimensional picture of your breast, which might make it easier to detect abnormalities. Breast MRIs are used in combination with mammograms to screen women who are at high risk for getting breast cancer. And again, you should know, do you have dense breast tissue? I personally had dense breast tissue and didn't know it until after I got breast cancer. So that's something you should talk to your doctor about. So breast cancer can be very confusing because there are so many different stages and types. To add to the complexity, there are many different treatment methods that depend upon the stage and the type of the cancer. The stage of breast cancer is determined by the following three parameters: the size or extent of the tumor, whether the cancer has spread to nearby lymph nodes, and whether the cancer has spread to the distant organs. Each of the stages we will discuss have more complex subsets defined by slight differences, but for today, we'll just go over the four basic stages. Stages 0 and 1 both have unaffected lymph nodes, and the cancer is not spread to the outside of the breast. Stage 0 means, or sometimes they call that DCIS. That means that the tumor is confined to the duct or lobe. Stage 1 means the tumor has grown outside the original location, but it's still a small tumor. And then stage 2 is when we start to see maybe some lymph node involvement, as well as a larger tumor than we find at stage 1, or even multiple tumors. In stage 3, we will find even larger tumors, continued lymph node involvement, and possible spread to muscles and or skin. Stage 4, which is also called metastatic breast cancer, is determined when the breast cancer has spread to any other part of the body. These could include bone, liver, lungs, or brain, and the location where the breast cancer is found can be a factor in determining the survival rate. As I mentioned, the type of treatment is directly dependent on the stage of breast cancer diagnosis, among other factors. We can never make any generalizations for treatment options since everyone is totally different. But typically, surgery is first suggested as treatment in order to remove the tumor. And then sometimes surgeons will suggest using chemotherapy or hormonal therapies prior to surgery to hopefully shrink the tumor if it is on the larger side, and would be easier to remove if it was smaller. There are two types of surgeries women can choose. And again, this all depends on the severity of the cancer and the woman's preference. The two types of surgery are lumpectomy, which includes a breast conserving surgery, or a mastectomy, which removes the entire breast or possibly both breasts. Following surgery, an oncologist might suggest additional treatment, including chemotherapy, radiation therapy, targeted therapy, or hormonal therapy in order to get rid of any potential remaining cancer cells that could be in the body and to hopefully lower the risk of recurrence. Reconstruction surgery is absolutely an option all women have following their either lumpectomy or mastectomy. Reconstruction options include implants, tissue, flap, procedures, which use muscle and tissue from other areas in the body, or maybe a flat reconstruction in which women can opt for an aesthetic flat closure. Because there are many different treatment routes, there are many members of a woman's healthcare team. These include her medical oncologist, a plastic surgeon, radiation oncologist, a surgical oncologist, breast cancer oncologist, sorry, and her primary care provider, as well as potentially a nurse navigator, a nutritionist, social worker, psychologist, and physical therapist. So a lot of people on your team if you have been diagnosed. So the last thing I want to do before we dive into BCRC is play a little interactive game of fact or fiction. So hopefully I can get this to go smoothly on the PowerPoint. After I read the statement, so I want you to do a thumbs up if you think it's true, or thumbs down if you think it's false. All right, so I'm going to read a statement and then you're going to let me know what you think here. All right. Let's see, here we go. So finding a lump is the only breast cancer warning sign. All right, what do you think? I see 2 thumbs down, 3, okay. Good job. Yeah, that's a myth. So yeah, and I already kind of mentioned something about that. Lumps are not the only warning sign. Other signs could include redness or flaky skin around the nipple or the breast, nipple discharge, a change in the size or shape of the breast, or pain. All right, next. You are not at risk of getting breast cancer if you have no family history of it. All right, you guys got it. Good job. That was me. I have no cancer in my family. It's like, hello. Yeah, only 5 to 10% of breast cancers are hereditary. All right, here's the next one. Underwear, bras, or antiperspirant may cause breast cancer. Thumbs up or thumbs down? What do we think? Oh, that's interesting. Okay. All right. So we've got a mixed group here. Actually, we say that this is a myth because there is no scientific evidence to support either of these increase your chances to get a breast cancer diagnosis. So there are many other environmental factors out there that we think do cause it. So thank you for your participation there. Love the thumbs up and the thumbs down. All right. So now that we've gone over the numbers, here you can see some of the terms our BCRC staff and clients use to describe what we do. Apart from patient navigation at BCRC, we offer many services to our clients, including outreach, education, patient advocacy, social support, and direct financial assistance when it's available. All of our services and programs are offered to our clients free of charge, regardless of income, ethnicity, education, sexual orientation, or social support. Our 3 main pillars at BCRC are guidance, education, and assistance, which I will go over in more detail now. At BCRC, all of our clients are assigned a patient navigator who walks through every aspect of active treatment through post-treatment with their clients. Patient navigators, me and my coworkers, assist clients. We guide them through their treatment. Before COVID, we would attend doctor appointments and infusion sessions. And we identify resources, including financial and integrative, such as yoga classes, counseling for clients and their families, and support for their children. What makes BCRC unique is that not only is every patient navigator trained, and with the exception of our newest hire, a certified community health, or excuse me, yes, a certified community health worker and certified through the Academy of Oncology Nurse Navigators or through National Consortium of Breast Centers. But all 6 navigators are also breast cancer survivors, as I mentioned at the beginning. They have been through, or we have been through every aspect of a breast cancer diagnosis, and can therefore offer a personal perspective like any other. It's like when I get a new client, it's like, okay, so, we share our stories and it's okay. So yeah, I've been through breast cancer. I totally get it. I really do understand where you're at. And, sometimes they really need that connection. We access the client's needs and excuse me, gotta get a drink, identify barriers that may impact the client's ability to get their treatment or successfully complete treatment. So here we are. These are the patient navigators. We each work with specific populations of clients. Karen and Yvette typically navigate younger clients under the age of 45. Jessica navigates our Spanish-speaking clients. Laura, Melissa, and myself work with clients of all ages, but typically those 45 and older. We support those diagnosed with suspicious findings by eliminating barriers to timely cancer screening, diagnosis, treatment, and supportive care. Patient navigation promotes the timely movement of an individual across the entire healthcare continuum, including prevention, detection, diagnosis, treatment, support, and end-of-life care. Patient navigation has shown value as a strategy to reduce cancer mortality and is currently being applied to reduce mortality in other chronic diseases. Some of the potential barriers our patient navigators assist clients with are advanced directives, citizenship issues, and undocumented status, confusing financial paperwork, difficulty paying bills, employment concerns, insurance coverage, and prescription assistance. We also assist clients in identifying childcare, food resources, house cleaning, post-surgical garments, and transportation assistance. We also work with clients to navigate lack of care team communication. That's huge. As well as health literacy, translation, diagnosis education, treatment compliance, treatment plan education, and post-treatment support. So in addition to the one-on-one support from patient navigators, we also offer a number of support circles and online forums for our clients. We have specific support groups for our clients diagnosed under the age of 45, our Black clients, our Spanish-speaking clients, and even a late evening group for our night owls and women who work during the day. Additionally, we have support circles for metastatic and young metastatic clients to support their specific needs. Our support circles and online forums give women the opportunity to connect with each other on a more intimate level and ask any questions that they might have. Clients find these resources very helpful and very supported by the other women in the group. Pre-COVID, we also provided support to our clients through weekend retreats, and we are definitely eager to start those again once it's safe to do so. At BCRC, we believe that empowering our clients with education about their diagnosis, medications, side effects, etc., is key to them thriving. Our patient navigators offer education about different treatment options and best practices as clients go through active treatment. And once a client is in the post-active treatment phase, she's offered the opportunity to engage in a 5-week course called After Breast Cancer, also known as ABC. The women enrolled meet once a week, and a subject matter expert, will spend that week going over the topics such as mental health, sexuality, and body image, nutrition, exercise, and lymphedema, which can occur after having certain surgeries. ABC provides an intimate venue for a handful of women to explore these and other topics in depth. We also have recently introduced a video resource library that contains short, like 15 to 20 minute video presentations on different areas our clients have expressed interest in learning more about. We have videos on topics ranging from grief and loss, from a diagnosis and treatment, health insurance coverage, and advanced care planning. These on-demand videos are not only for our clients, but anyone in the world to access the information on our website. So oftentimes our BCRC clients are forced to choose between their well-being and paying for food or bills. We can often help to alleviate that by providing our clients in need with grocery and gas gift cards, in addition to limited financial assistance when funds are available. In addition to financial support, we also offer physical support to our clients in a number of ways. We have partnerships with organizations that provide our clients with house cleaning services, meal delivery, and lawn care, all free of charge. And of course, before the pandemic, we also were able to assist clients by attending infusion and doctor appointments. That is not allowed now. I can't wait for the day to start that up again. Clients were so appreciative of this, not only for providing the additional support, but they enjoyed having a friendly face in a very uncomfortable environment. So in the next slide, let's see what BCRC means to one of our clients.
My name is Jan. I'm a physical therapist. I love live music. I enjoy swimming and being with my family, playing games. BCRC is, it's my favorite nonprofit. They helped me with a time in my life that was difficult to get through. They were there for me and faithful and ready to help. I feel like after breast cancer, I really appreciate just the small moments in life. Like just a hug from one of my sons, or sunshine, or looking at the Texas night sky. It's just really tiny things like that that you weren't sure if you would even live to see again, and just small things.
Yes, Jan is awesome. And I think most of us as survivors pretty much feel the same way as she does. And I'm so happy to be here and be able to be a navigator to help other people figure this whole thing out. This next slide shows some of the local community organizations that we partner with to provide additional resources to our clients. Wonderful groups here. Oh my gosh, they're all amazing. Wonders and Worries provides therapy for children of cancer patients, children 18 and younger, cancer rehab and integrative medicine. They have a lymphedema acupuncture and massage therapy, that is all connected to having a cancer diagnosis. So a lot of experts there that really help us out. Livestrong has classes at the YMCA if you have been any type of cancer survivor that you can participate in, as well as these other wonderful food. They give us food to give to our clients when they're going through chemotherapy. So yeah, awesome groups. And we have so many ways for you to connect with BCRC and stay up to date with our events, support circles, partnership, fundraising, anything, any other opportunities that we have. Of course, bcrc.org, and then all of our social media. You can connect with us on any of these social platforms. As well as, there's many different ways to get involved. We have opportunities for volunteers. Again, if you go to bcrc.org, you can find out about volunteer opportunities, which are rather limited right now because of the pandemic, but there's still opportunity out there. So anyway, thank you so much. I just really appreciate you taking time out of your day to learn about BCRC and how we serve our community, and as well as anyone diagnosed with breast cancer. So that's my presentation. I will end that slideshow if I can. There we go.
Awesome. And before we close out, does anyone have any questions? If so, you can either unmute yourself or you can drop the question in the chat box. Either way works.
I don't have a question. I'm Cammie. I don't have a question, Danielle, but I do want to share. I guess I didn't know what the thumbs up and down, but some years ago, I think 2012, my sister was a breast cancer survivor.
Oh, okay.
So she went through that, I wouldn't call it an experience, but that emotional trail too as well.
Yeah.
This is very good. I'm starting to click and be a part of what breast cancer wellness is all about too. Stay connected.
Yeah, I was really glad we were able to get Mary Ellen to do this presentation. It was very good.
Well, I appreciate all of you. Now I get to see you all because I wasn't seeing you before. So yay. That and we're here for you, or if you know anyone that is having to deal with this, and we also can point them in the right direction if they don't have resources to get that mammogram, because we all need to get that mammogram. Especially, the top, the points that I mentioned earlier. Sorry. I got braces, so I'm having a hard time talking. I'm just gonna let that out. Yeah, so we have resources that we can point people in the right direction if they cannot afford to get a mammogram, and find out if you have dense breasts, because I didn't know that. And oh man, I found my breast cancer myself, so it wasn't found on a mammogram. It was found from my self-examination and knowing my breasts. So be aware.
Well, thank you again. And for all of you, once again, that are in here right now, oh gosh, you will be receiving a little wine tumbler. So,
Hey, Dr. D, I wanted
Yes.
to share something real fast.
yes.
I don't know if you guys know, and maybe Dr. John doesn't want me to tell you, but his mom was diagnosed with breast cancer and died when he was 10 years old. And so when he was looking into chiropractic school, he wanted to give a more wellness or other options. He felt like maybe if his mom had other options, not that chiropractic can cure cancer, because it can't, but he just wanted to give people a better, healthier opportunities to then be able to do what they love and live. And so this is really close to Dr. John's heart too. And we'll definitely be getting with you, Mary Ellen, and find some ways that we can help with volunteering or whatever we can do to help y'all, because that's awesome. That's amazing. I'm so proud of you, Mary Ellen. You are my hero.
Aw, thank
Thank
you,
you for taking the
Lexi.
time to educate us and to help us. And so thank you.
Yeah, no, it's my pleasure. We got to get the word out and we got to help as many
Yeah.
people as we can. So I appreciate your assistance and Dr. John, helping me, because as a survivor, it's important for my follow-up care. And I mean, I totally believe in traditional medicine along with integrative care.
Oh,
and
yeah,
chiropractic
definitely.
is huge. So yeah.
Well, I just wanted to say thank you.
Well, thank you all for having me.
Well, we'll just wrap it up here. Let's